My name is Dr. David Thiel. I've been a staff urologist at Mayo Clinic for 12 years, and I'm chair of the Department of Urology at Mayo Clinic in Florida currently. My specific area of focus is minimally invasive surgery for complex urologic malignancies such as renal cell cancer and prostate cancer. I think referring physicians should be aware of the fact that we treat complex prostate cancer and renal cell carcinoma patients in a minimally invasive fashion. This includes patients that have had previous therapy for prostate cancer, specifically radiation therapies, and their cancer is returned. We offer complex imaging technology in the form of PET scanning that allows us to determine where we think the prostate cancer would have recurred, and a lot of times we're able to operate on that recurrence in a minimally invasive fashion utilizing robotic technology. For kidney cancer, we're able to resect a lot of big kidney tumors, specifically those tumors that have gone into the inferior vena cava or stage 3 tumors in a minimally invasive fashion, either using robotics or laparoscopic technology. A large advancement for us in urology centers around prostate cancer, but not specifically prostate cancer treatment. It centers around prostate cancer diagnostics. What we're able to do a lot of at Mayo Clinic is do advanced imaging of the prostate, find what we think may be prostate cancer, and then we now have the technology to biopsy these suspicious areas in a focal fashion as opposed to a random biopsy of the prostate to help us be more accurate in not only diagnosis of prostate cancer, but also location of prostate cancer, as well as which cancers are clinically significant and which are not. That has huge treatment implications because we know that many patients with prostate cancer can be observed or monitored versus those that need treatment or potentially life-saving treatment. So a huge advancement for us has been the ability to do focal isolation of prostate cancer or focal biopsies of prostate cancer as compared to random prostate cancer biopsies or diagnosis. Another large advancement that makes Mayo Clinic unique is our ability to treat patients with benign prostatic hyperplasia or obstructing prostates. We now offer the ability to enucleate a prostate with a laser, what we call holmium laser enucleation of the prostate, or HOLEP, which gives us the ability to enucleate prostates in men with very large prostates who are either having a hard time urinating or cannot urinate in a minimally invasive fashion, where patients go home either the day of surgery or the day after surgery with the ability to urinate. That's been a large advancement for us at Mayo Clinic. The newest treatments on the horizon for kidney cancer, first of all, center around metastatic kidney cancer or kidney cancer that's spread. We now offer an array of chemotherapeutic options that we weren't able to give before. The beauty of that is that we're seeing patients who had inoperable conditions respond to these numerous different types of medications, and then we're able to go and perform possibly curative surgery on many of them. The biggest advantage to a physician referring a patient to Mayo Clinic is our ability to treat complex urologic conditions with their associated complex medical conditions in a multidisciplinary fashion. We're able to treat complex urologic malignancies with the opinion of multiple medical experts, and we can receive that information rapidly. Our ability to bring these patients in and have them see numerous specialties in a multidisciplinary fashion not only gets them more educated, but it also relaxes them and allows them to know that there is a lot of different treatment options in our setting.